we will talk about the pinkish flush on the cheeks. Rosy cheeks can be normal in many cases. This happens due to the dilation of blood vessels near the skin of the face. Rosy cheeks have historically been associated with good internal health and vitality. However, it's not always an indicator of good health. Sometimes, it's caused by disease. We will explore the top 5 causes responsible for rosy cheeks. First, let's discuss when it is normal. Rosy cheeks are normal if they occur after physical activity, due to increased heart rate and blood flow. Some people also have a natural pigmentation of pink, usually observed in other family members as well, suggesting a genetic influence. In such cases, rosy cheeks are present since early childhood. Additionally, it's normal when there are no other symptoms, the skin is not irritated, does not have a changed structure or become rougher, and there's no itching or unusual texture changes. When normal, the redness is symmetrical on both cheeks and does not present as any roughness of the skin. Rosacea is the first disease that should be suspected in the case of rosy cheeks. Rosacea is characterized by the redness of the cheeks, sometimes extending to the whole face, nose, chin, and other parts of the face. A second common sign is visible small blood vessels, known as telangiectasia. Rosacea can resemble acne, as it may also present with papules and pustules, papules being red raised bumps, and pustules being pus-filled lesions. Skin thickening is more common among men. Rosacea is more prevalent in adults but can occur at any age and is more common among women. Individuals with fair skin are at a higher risk of developing rosacea. Exposure to sunlight, extreme temperatures, and wind increases the risk. The exact cause of rosacea is unknown, but it may be due to vascular abnormalities, an overactive immune system, or mites, although the last possibility is not clearly defined. As a first line of treatment, metronidazole, azelaic acid, and ivermectin creams or gels are used to reduce redness and the number of pimples. Avoiding triggers and using sunscreen is advised. As a second line of treatment, laser therapy and light therapy can be effective. Isotretinoin may be considered for severe or treatment-resistant cases. The second disease to consider is Fifth Disease, a viral infection characterized by a distinctive slapped cheek, rash caused by the parvovirus B19. The most important characteristic is a bright red rash on both cheeks, giving the appearance of having been slapped. During the infection, symptoms can include low-grade fever, headache, and sore throat. It is more common among children aged 5 to 15 and typically occurs in late winter or early spring. Fifth disease is usually diagnosed based on its distinctive rash and typically resolves itself without treatment, usually within 3 weeks. Atopic dermatitis is another condition common among young children that can cause rosy cheeks. This condition is characterized by dry, itchy, and inflamed skin, often manifesting as scaly, rough patches. It tends to flare up periodically and subsides after some time. The mechanism is complex, involving genetics and environmental factors, but it is thought to develop because of an overactive immune system and an allergy to irritants and allergens. For diagnosis, rosacea, contact dermatitis, and psoriasis should be ruled out. Treatment includes moisturizers and topical corticosteroids. Additionally, sunburn, windburn, and cold weather can cause red cheeks, but this is usually temporary. Allergies can also cause rosy cheeks. Contact dermatitis is another possibility, occurring when a person has physical contact with an irritant. For example, a child may come into contact with a plant like poison ivy, known to cause skin reactions in many people. If the child touches the plant and then rubs their face, transferring the plant oils to their cheeks, redness can develop.